Hello everyone, I am Dr. Purnima Nadkarni, Director of Nadkarni Group of Hospitals, Kilapadi, Vapi, Valsad and Surat. It comes in South Gujarat. I would like you all to join me in a live webinar which is kept on 26th of March, that is Thursday at 3 p.m. onwards. Now this time I'll be talking on clinical management of heavy menstrual bleeding. Now, usually we as a gynecologist, we always come across women of all the ages having heavy menstrual bleeding. Sometimes we used to call it DUB, now we call it abnormal uterine bleeding, AUB we call it now. You face such patients in adolescent, you face such patients in the reproductive age group, we face them in premenopausal age group, sometimes postmenopausal also. There are various causes, and recently FIGO has classified as a palm coin. So it can be polyp, it can be adenomyosis, it can be leiomyoma, it can be malignancy, it can be anatomical cause, it can be anovulatory cause, it can be hormonal cause, and it can be premenstrual, etc., premenopausal hormonal problems, etc. So there are various causes of this heavy menstrual bleeding. There are various investigations also. We will discuss upon what are the investigations, right from the ultrasound to CT scan to endometrial biopsy to hysteroscopy and to all the blood examinations for hypothyroidism, hypoprolactinemia, hormonal paradigms. Everything will be discussing on that day. So these are the investigations, and there are various types of treatment. Treatment depends upon what is the cause of the heavy menstrual bleeding. It's a hormonal cause, we give hormonal treatment. If it is hypothyroidism, we give thyroid treatment. If it is a anatomical cause like a septum, or it may be a fibroid, polyp, we treat it accordingly. Malignancy has got a different pattern of treatment. Here in this seminar, on that day, I will be discussing upon one combination of OC pill, which is a fourth generation progesterone and ethinyl estradiol combination, that is Dynogest with ethinyl estradiol combination, and we'll be discussing in detail about various studies and how it is effective and there are no side effects, etc. So friends, please join me on 26th March 3 p.m. for this live webinar on clinical management of heavy menstrual bleeding. The initiative of this program is taken by Alembic. So we are thankful for Alembic for sponsoring this live webinar, and we are also thankful to DocMo Digital Knowledge Marketing Platform for taking this beautiful educational initiation. Thank you.